So now we're going to go over infraspinatus. Infraspinatus is a very important muscle in shoulder function, shoulder stability. It's really important anytime you're pressing or reaching or going to grab things, and a lot of times it becomes very dysfunctional. Now, a lot of therapists make a bad job with this because it's actually very superficial. It's not deep. All that's really between that is some skin, a little bit of subcutaneous fat, and then the muscle, and it sits right there. But the weird thing about the infra is there's like a 45-degree turn of the scapula. So what happens is people are way too compressive and they go in there, and in order to break that scar tissue down, you need proper depth and proper tension to get in there. So the first thing is you just want to get in there and actually be able to palpate it, because if you can't find it, you sure as hell can't fix it. So the way I like to palpate that is I'll have them bring their arm up and just bring it straight across, just like that. And then what this will do is I'm going to kneel down, is I'm going to have a couple landmarks. I'm really big on bony landmarks and finding our place. So the first part I'll find is the superior angle of the shoulder, and then across here goes the spine of the scapula out through here, and then down through here is the lateral border. Where the infra lives is right in through here. And usually where you're going to find dysfunction and scar tissue formation is usually right in the muscle belly and through there. So now I have that set up, and I'm going to be able to palpate. And in order to palpate, what I like to do is get my arm set up just right to dictate the motion and the line of drive. And what I'm going to do is actually face at, like, I call it like a negative 45-degree angle, where my line is going to go here and I'm going to go here. So what I do first is I get in here, and a key thing here also is I have my fingers go across, and my hand and my thumb is almost like pointing down. A lot of times when we treat, we're here. This one's different. This allows you to keep that line of drive in your elbow and in through your thumb. So now I'm here, and then the next thing I'm going to do is I'm going to lock and key that. And I've talked about lock and key before, but basically you're going to go in here and let it sit in there. And you're going to start to just get in there and do some compressive palpation to find where that muscle, and I'm going to remove my hand so you can see it, and I'm going to go in there and feel where that muscle isn't compressing, and right there is where that scar tissue is. So what I'm going to do next is I'm just going to go a little bit lateral to that, and I'm going to be here, and I'm not going to use my hand on this first one just so you guys can see it. And what I'm going to get first is I'm going to get some depth with my body, and I'm going to back out about 10%, and then I'm going to get some tension about a 1/4 inch into that scar tissue, and that's how I'm going to load that up. So the motion for the client is they are going to start their shoulder just like this, and then I'm going to have them bring their arm straight across just like that, and when it gets close here, I'm going to have them grab on their elbow and just pull it just a little bit, just enough to clear their chin. It's not a race to like yank their arm across. It's a very easy, slow, gradual motion. When it gets close here, I'm going to pull it just a tiny bit over. So now we know where it is. We're going to set it up. She's going to be here. I'm going to approach at that negative 45-degree angle. I'm in here. My hand is going straight across with my fingers. I'm here. I'm set up. And my first way to get my depth is going to be a lean with my body and a little push with this opposite pec. So I'm going to lean, push in, back out about 10%, and then my tension is going to be a lean with my body. I'm going to pause for a second, and then she's going to go ahead and start that motion. Go ahead. And it's called internal slide. It's just coming to me, and we're moving it. Keep going, keep going, keep going. And you're just going to feel that tissue slide underneath you. It should be a very gradual build up as we're doing it. If you feel it pull right away, you're usually too compressive. This needs about 8 to 10 ounces of force. That's not a lot, but it needs the tension in the right area. So make sure your body is lined up. You're lined up for success, because if you start getting your elbow in different places, you're not going to be able to generate enough force, and it's not going to be an effective treatment for your client. So that's the video for treating infraspinatus.